I wish I had a microphone. Let me say, as a follow-up to Whitman, there are 2 clipboards on the table right over there where you can sign in and request an in-person town hall with Whitman, both for March and April. You have to put down your name, your address, your phone number, and email, because those are the criteria for requesting even a meeting with him. So that's why all that information is requested. Also on the table are educational and enrollment materials for the Affordable Care Act. I'm a health insurance navigator, currently a volunteer, but I've been enrolling people for 4 years now, and there's information there for you and for others if you want it.
Sorry.
Rabib asked me to say a few words based on my own experiences with the Affordable Care Act. And this is what I would say. Democracy is always a work in progress. In March of 1966, Martin Luther King addressed the medical community on human rights in Chicago. He was talking about the disparity in medical care in the United States. And it was during that address that he said something that becomes one of the top 10 quotes from Martin Luther King. He said as follows: "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." He says, "I see no alternative to direct action and creative nonviolence to raise the conscience of this nation." That was in 1966. A few months earlier, Medicare and Medicaid were created as amendments to the Social Security Act. They were fiercely contested, but they finally passed. And there was so much of a hunger for those 2 programs that by July of 1967, 1 year later, 19 million people had enrolled in Medicare. 19 million people in 1 year. Sound familiar? As of 2015, there were 55.5 million people in this country enrolled in Medicare. As of 2016, there were 70